Dr. Madhuri Vidyashankar, a dedicated gynaec, laparoscopic and hysteroscopic surgeon for the last 15 years. Today I will be discussing with you regarding the fibroids on the occasion of the Fibroid Awareness Month. See, there can be two things. One is the patient is having symptoms but they are not aware that it's an abnormal one, and the second one is they may be totally asymptomatic. So what is normal menstrual cycle? If we can tell about this, perhaps the women can make out what is abnormal with them. So a woman having periods once in say 21 to 35 days interval and lasting for any time between 21 to 35 days is fine. Happening much before that or beyond that is abnormal. And in fibroids, if the periods are happening more frequently or for a longer duration of period. Normal duration is somewhere between around 2 days to 7 days. Anything beyond this is taken as abnormal. If the women pass clots in their periods, it is definitely abnormal. Bleeding beyond 7 days of periods is abnormal. Using more number of pads is also abnormal. Along with this, if the women are having tiredness, fatigue, unable to carry on their daily chores of work, that could again be abnormal. So when women say that they do not have symptoms, they may still be having heavy periods, heavy menstrual flow, but they may not be aware of these symptoms. So asymptomatic women or women with these kind of symptoms, if we can pick up early, we can help them from preventing anemia and giving them the respective treatment at the required time. Women usually after 30 years of age are suggested to go for regular gynecological health checkups. Especially those women above 40 and 45 years are certainly advised to go for health checkups yearly once at least, or if they have symptoms. So regular health checkups can help pick up the symptoms as just enumerated, that is heavy bleeding during the periods or even pressure symptoms. Some women come with pressure symptoms, that is lower abdominal, sometimes mass, or even saying that they pass urine very frequently. And many times they think it is urinary tract infection and may not get it treated adequately. But it is actually the fibroids which are pressing upon the bladder and causing these symptoms. So pressure symptoms, menstrual symptoms, and sometimes even discharge per vagina. When a fibroid is present in the vagina, they can present as foul-smelling discharge in the vagina. So these are some symptoms that they have to look for, and we pick them up when they present with these symptoms. Also, examining the women in the clinic will give us an idea if they have large masses or they are palpable when we examine them clinically. The third thing that we can pick up is, one is symptoms, next is examination, and the third thing being imaging. What we do routinely in these patients when we detect something clinically is ask them for an ultrasound pelvis. In ultrasound pelvis, we will be able to pick up the fibroids arising from any part of the uterus. So that helps us detect these much earlier when they come even without symptoms. So these are some of the ways we can definitely pick up the fibroids, and of course we cannot overemphasize about the patient education, people education rather. So awareness regarding the menstrual symptoms, awareness regarding the presence of fibroids, and even the tiny symptoms that can help them pick up the fibroids can help take this a long way to detect the fibroids. Alright, fibroids can come in multiple sizes and multiple places in the uterus. So the uterus has the body, the inside of the uterus, and the wall of the uterus, and the cervix. So it can arise from any part of the uterus. And they can present with any symptoms like infertility, excessive bleeding, or mass per abdomen. So depending on what the patient presents to us with, whether it is the huge mass or the infertility or the excessive bleeding, we advise them surgery depending on where the fibroids are present and how they are amenable to minimally accessive surgery. So if we go by the size, there is no limit to the size that we can operate. So it is purely the space that is available when we examine, even up to say 15 centimeters, 20 centimeters have been done laparoscopically. That is, say when the patient has around 6 months, 7 months pregnant uterus size, provided it's a single fibroid or easily amenable, we still do laparoscopically. Not just the size of the fibroids, it's also the location. See, the location in a very dangerous area of the uterus, that is the broad ligament or in the cervix, even smaller fibroids can be very risky operating. So it also depends upon the expertise of the surgeons, the laparoscopic surgeons, where they can advise for a laparoscopic, that is a minimally invasive surgery or an open surgery. Very large fibroids or fibroids which have multiple fibroids sometimes may require open surgery, where a minimally invasive surgery may not be advisable. So we go through the patient symptoms, their imaging and clinical examination, and also the FIGO staging of the fibroid, and decide what is best for the patients, whether it is the minimal accessive surgery, invasive surgery, or whether it is the When we talk about medical management of fibroids, we have few medicines which can shrink the fibroid to a certain extent when the patient is on these medications. These can be used, when the patient is not ready for a surgery. Patient has symptoms like excessive bleeding and pain, especially these two symptoms, and patient is unable to go for a surgery. So it can help the patients to tide over this phase when they are till the time they are ready for the surgery. That is one. Then the second thing is when the patient is perimenopausal, she is almost waiting for her menopause, and she has a lot of symptoms related to fibroids, that is excessive bleeding and pain. So you can manage these patients with the medical management for a while when these symptoms will reduce. The infertility group of patients may not really benefit from this medical management, because when the patient is on these medications, they will not conceive, and the actual treatment for these patients with infertility would be removal of the fibroids. So certainly yes, there is a subset of patients who will benefit from medical management. So when we say complex fibroid cases, it could be, they could be having multiple fibroids, big sized fibroids, large uterus because of multiple fibroids, or a large single fibroid, or they can be broad ligament fibroids, or they can be large inside the cavity fibroids which are causing infertility. So when we have a team of doctors, that is, you have a great team with radiologists, with the gynecologist, and also the infertility specialist, we will be able to give the best kind of treatment. When we say best, when you can give a minimally invasive surgery for any kind of these surgeries, and also give them the best pregnancy results, having an infertility specialist along with you goes a long way in giving the best treatment for these patients. So a radiologist helps us with all the imaging and even mapping each and every fibroid, wherein the laparoscopic surgeon can remove the most of the fibroids or all the fibroids, and at the same time the fertility specialist will be able to see where exactly the fibroids are, whether it can give her the best pregnancy results. So having a great team will definitely go a long way in giving best results. Basically scared that they could have excessive bleeding, which may necessitate removal of the uterus itself, or the fibroid could be so huge that it cannot be removed and it could require removal of uterus itself. And the third thing is that there could be malignancy in these fibroids. These are basically the major concerns in these women that we see. So we deal with every patient individually, discuss all the risks that are involved, and offer them minimally invasive surgery when it is definitely feasible. And in those patients where there is necessity of removing multiple fibroids, or there is risk of excessive bleeding, we give them options of open surgery so that we can prevent removing the uterus instead of doing a laparoscopic surgery. So avoid a laparoscopic surgery, give them a laparotomy, that is an open surgery, but preserve their uterus. This is what is our advice to these women. And also, these fibroids are mostly benign. They are mostly benign. They don't have cancers in them. Very, very rarely there can be cancer in them. So this reassurance to these patients, and of course, removal of fibroids will not cause infertility in these women. Very rarely there can be adhesions inside the uterus, which can be dealt with good surgical methods. And these are all counseled thoroughly preoperatively to all these patients. Give them support with regards to in regards to testimonials, patient support groups, and with this the patient's fears will definitely be allayed. So if I can tell from my experience, what we have seen is when we see younger patients coming with a large single fibroid, rather than trying with any other method like uterine artery embolization or HIFU, going for a simple myomectomy, that is removal of the fibroids, can give her a long-term recurrence-free period and also better fertility chances. Similarly, when younger women come with multiple fibroids, say more than 8 fibroids, 10 fibroids, 15 fibroids, going for a laparoscopic surgery may not be really worth it because she may present to you with many more fibroids yet again. In these patients, going for an open surgery, removing even the tiniest of the fibroid, like even the 5 millimeter fibroid, will go a longer way in preventing the recurrence of these fibroids and also help her in going for a pregnancy. And in those women who are closer to their perimenopause or menopause, having multiple fibroids, they may still approach you with removal of only the fibroids, trying to keep the uterus. They may not really benefit from, in a long term, they may not benefit from removing just the fibroids. So counseling them for a removal of fibroid, not just the fibroid but the uterus itself, helps in preventing the symptoms. So individualize every patient, see what can give them a long-term prevention of recurrence. That will help in reducing the number of surgeries and the cost of surgery as well. And also choosing the kind of treatment, like whether it's a surgery or uterine artery embolization or HIFU, depending on the patient particulars and depending on the size of the fibroid, can also help in reducing the cost. There are multiple biomarkers that are being studied, wherein it can be a blood test which will pick up specific proteins or the mutations and help you identify those patients who could be at high risk of developing fibroids or who could be having high risk for recurrences. And there are AI-based imaging technologies that are being developed for higher sensitivity and detection rates, and also better sensitivity rates by even the less experienced radiologists. There are these newly available medical therapy which can treat menorrhagia and pelvic pain without the requirement of surgery for a while. See, integrating all these modalities, offers a personalized and proactive approach. There are multiple biomarkers that are being studied, wherein it can be a blood test which will pick up we can request all the people to be aware of their symptoms, to be taking general health checkups at least yearly once, so that the asymptomatic fibroids or those symptomatic can be treated at the earliest. Fibroids are innocuous, they are not cancerous mostly, and they can be treated in the most minimally invasive manner, even if they are big ones. So do not hesitate to meet your doctor when you have the symptoms or when you have been diagnosed with fibroids. We can request all the people to be aware of their symptoms, to be taking general health checkups at least yearly once, so that the asymptomatic fibroids or those symptomatic can be treated at the earliest. Fibroids are innocuous, they are not cancerous mostly, and they can be treated in the most minimally invasive manner,